Close-Up on America's Business, the program that takes you inside some of the most unique and successful companies in America. Hi, I'm Nancy Hornback. On each edition of our show, you have the opportunity to meet some of the most innovative business leaders in the country today. You'll find what their products, services, technologies, and business models can do for you, and what they're doing to change our world and change the way we do business.
We all want to have a great smile and a healthy mouth, and that means having a great dentist. But far too many people let their appearance and their oral health suffer because they think going to the dentist is scary or uncomfortable or even painful. And in some cases it is, but not here. Hi, I'm Janice Marie with Close-Up on America's Business, and we're here today in Midtown Manhattan at the New York Center for Aesthetic and Laser Dentistry, where you'll find Dr. David Poiman. He's one of the most technologically advanced dentists in all of Manhattan, offering general, restorative, and cosmetic dentistry using laser technology that he says will make a trip to this office virtually pain-free. Let's take a look.
Lasers is a great thing, and laser gives us an ability to treat people virtually without any pain and no shots. That's the most important thing. And people are coming out smiling and happy, and it's the dentistry of the 21st century.
Tell us how technology today can equate to a more minimally invasive approach to dentistry.
Absolutely. Well, the whole idea of minimally invasive dentistry is to intercept the disease before they start and prevent the disease. So I'm actually a member of the World Congress of Minimally Invasive Dentistry. I think I'm the only member in New York City of the Congress. And we specialize in diagnosing the carious lesions very early. We have a special diagnostic devices, which is not the laser, but it's a special high-intensity light that helps us to diagnose cavity before it develops. And we use the laser to minimally, basically, just find that little small lesion and cut directly into that, maybe sometimes just a fracture of a millimeter. And the technology gives us an ability to intervene very early and put a very conservative small filling in there. And that requires no anesthesia.
The process was non-invasive. It was easy. I fell asleep while it was happening. I got home, I took a nap because I hadn't gotten a lot of sleep the night before. When I woke up, the Novocaine had worn off, and there was absolutely no pain, no recovery, nothing else. I mean, it was like that. And that's the way it should be, by the way. Zero bleeding, zero recovery. It was just great. And the other part of it is it's so nice to be in bad shape, anticipate this long process. But it's not like that. You walk out of the office, ta-da, you're back. You're in good standing dental-wise. And if you take good care of your teeth, you don't have to think about it anymore. That's really, it's exciting. It's good to be a patient of Dr. Poiman, particularly at this stage.
There are a lot of dentists out there that aren't using the technology that you're using right now. How is the experience the patients are going to have different with them than it's going to be with you?
Well, the other doctor would have to take the old drill out and, do it with a drill and with anesthesia. So by using the laser, I can do different parts of the mouth of the person at the same visit, and most importantly, without no anesthetic. We can treat right side and the left side, and you will leave my office without that numbing sensation that we all love, and go and proceed with your daily activities, business meetings, lunches, whatever you have in mind. And that's the difference in between the conventional way and the new laser way.
So as an endodontist who's a root canal specialist, I've known Dr. Poiman for about 5-6 years now. I work very closely with him when he needs specialized care, like microscopic type of procedures. He refers the patient to me. The success of my work depends on the quality of the work that is delivered by the primary care doctor. In this case, would be Dr. Poiman. And it's delightful, and it's a privilege to work with quite accomplished and caring practitioner who makes sure that the work is delivered properly and thoroughly all the way to the end. And it makes our life and the patient's life much easier when you work with a very dexterous and competent practitioner.
There are a lot of studies done that link the gum disease to a lot of systemic disease like diabetes, heart problems. It's the similar types of bacteria that are found in the gum disease that can cause really, really serious health problems. So by treating the gum disease, a lot of people require surgeries. And the way we utilize the laser, we can do virtually the surgery of no cutting and no stitches. Laser allows us to make a very small incision, and it creates, at the end of the surgery, it creates a special blood clot where your body utilizes all its energy to heal and regenerate the bone. And that's actually the only FDA-approved procedure that's been approved on the basis of clinical studies versus grandfathered procedure, and has really great long-term studies and shows really great effect.
I had needed work for my gums because I had developed periodontal disease, so I went to the periodontist, and he mentioned that I would need periodontal flap surgery where they have to cut and stitch your gums. And he said it would be very painful, and I'll probably miss a lot of time out of work. So I did some research, and I came across Dr. Poiman. I came in and spoke to him, and he mentioned about a laser procedure called a LANAP, or laser assistant new attachment procedure with the periolase. So after speaking with him, I decided to give it a try and see what happens. And the surgery came out pretty well. I had almost no pain. I was able to return to work the very next day with minimal discomfort. And it's been a very, very rewarding experience. My gums are a lot healthier. They're a lot pinker now. My teeth feel a lot stronger. It's been very enriching and rewarding. I thank Dr. Poiman for all the work he's helped me with and the follow-up treatments, and it's really helped me a lot.
I think most of the patients appreciate coming in because we treat them as a part of a family. They're wellness partners. We try to help everyone with their issues and problems in the first place, and we help people to overcome their difficulties with their oral health. It's not only changing the smiles. It's, if you think of that, the mouth is the first entry of anything that goes inside of your body. So people that have, for instance, gum disease, they have bacteria, they have pus in their mouths, and by doing the surgery, it really is a great service. A lot of people feel healthier in general. They feel cleaner, they feel healthier, and if on top of that you solve their health issues and you go into the aesthetic aspect of that, you create a beautiful smile, it really changes the whole attitude about life. The person becomes very upbeat, very positive. It's really great.
Well, as you can see, a visit to Dr. Poiman will give you a great reason to smile. From Midtown Manhattan, I'm Janice Marie.